So our next speaker is Dr. Chris Sotiropoulos, who will highlight the role of philanthropists to respond to emergency. He's the co-founder and CEO of Global Opportunities, Commercialization, and Director of APAC Health. Dr. Sotiropoulos is also actively involved in healthcare international trade and charity bodies such as Rotary. He's a frequent international speaker, speaking at forums in Europe, USA, Africa, India, and the Asia Pacific on themes affecting nationalhood, capacity building, peace building, education models for emerging nation, youth, and women empowerment. So Dr. Sotiropoulos, thank you again, and the floor is yours.
Thank you very much. Hello, everyone. Chair Jawahir Dahir, representatives of GSD, DMAC, IOM, UN Migration, eminent speakers, international guests, friends, viewers online, and special thanks to Mr. Ahmed Toho. So let's talk about the role of philanthropists to responding to this chronic emergency. What are philanthropists looking for? Well, traditionally, they have relationships with international bodies and the diaspora. They have relationships with the United Nations. Interestingly, they're now emerging with relationships that are commercial linked. In addition to relationships with governments, for example, in Australia, very active in coordinating, leading, and partnership as well. And in fact, our organisation, GOC and Rotary, has had a very strong relationship with the Somalian Australian communities and also the African community in Australia. So we are constantly hearing about what activities and measures are needed back in the homeland of our fellow citizens. And through international groups, we are now commencing a continuing interaction. So again, philanthropy groups are looking for delivery, consistency of delivery, supply chain. They need to understand logistics, that when they are involved in a project, activities will deliver to the defined areas. They need to know that there are legal structures in place, that there is transparency and good governance, and that this allows for repeated interaction to solve very pressing problems. So in this situation, this tragedy at the moment with both COVID and drought in Somalia, who takes the lead? And this is a question which I pose to all of us from today's summit and moving forward as well. Is it GSD? Is it DMAC?
So is
it the IOM group?
I'm about to create very quickly an email.
Is it a country that takes the lead? Is it a third party, or is it a combination of these? These are very important questions because philanthropists, both global or regional or national, need to understand who the lead champion is. Transposing back on the issue of today, what actions are available today to help Somalia? In the COVID-19 sphere, vaccines are available. We can get Somalians vaccines. AstraZeneca, the Pfizer, the J&J, the Sputnik, and of course there's the Chinese one as well. But we can help distribute and make those available to Somalia through philanthropic relationships. Diagnosis, wonderful diagnostic tests, rapid as well as not so rapid, but still very important. Management, what I would call management, issues like lockdown, social distancing, how you communicate that to a population, how you manage it. These systems are in place, and we have seen, for example, in Australia, which is easy to manage because it's an island and you can stop people coming in compared to other regions. We have developed very good programs for that. Hospitalization, medical equipment, processes. We have access to that expertise. And home management. Sounds like a funny word, but what it's really saying is that how should we conduct ourselves in our own residence in this era of significant spreading, as we've noticed in the last few weeks in many parts of the world. These actions and expertise is available today, and philanthropists would dearly love to get involved to deliver these. In the drought sphere, there are many global experts who would be available to lead their assistance. Disaster relief agencies, as well as financial institutions. So what are the next steps? Well, an organising framework needs to be established, and we're happy to help to set it up or to advise on that process. But the framework needs to have leadership as well as people who have demonstrated performance of project management and interaction with government. Now, why are these frameworks important? Because philanthropists need to be able to put resources into an existing mechanism. Again, what's available in terms of links and resources? Vaccines, management, human management, as well as hospital equipment and expertise. Funding. A lot of people say, well, it's very difficult for us to fund these tragedies of COVID and drought. But funding is available, both for governments and for groups that come in and provide remedies to particular regions, as well as expertise and experience in the drought area. The philanthropic community is waiting to be engaged. In fact, we speak to many of them several times a week about different parts of the world. And thanks to the GSD member, Mr. Ahmed Toho, who we know very well in Australia and is very well respected, this issue has become not number 10 on the list, but number 1 and number 2. So that role of the diaspora in Australia is extremely critical. And I commend the diaspora for taking that role. So the philanthropic community is waiting. The governments, including the Australian government, is eager and available to help. They are also helping initiatives locally in their backyard, the so-called Pacific Islands and parts of Asia. And resources, including money, can be allocated. Do not be dissuaded by the fact that, oh, it's very hard to get money. It isn't. When the framework is in place and the leadership and legal transparency and expertise is in place. So we're very confident that working together or assisting the collective of organisations here led by GSD, a significant impact can be made in the short term as well as medium to long term, along several of the elements that even Dr. Magdalena Simonis alerted to, in order to even stamp out quite substantially the tragedy of the pandemic, not just in the medical side, but also in other aspects of human and economic existence. So we, Australia, GSD's diaspora in Australia, Ahmed Toho and others, including Dr. Magdalena Simonis and her far-reaching relationships into the country of Australia, our group, as well as Rotary, which has substantial international networks and is looking to make a difference as well in Africa, dearly want to help Somalians directly, but also indirectly. How are we doing it indirectly? We'd love to introduce you to our networks, to the relevant funding sources, to the relevant experts, to the people who can air freight vaccines to Somalia within a few weeks. that's all I wanted to say today, but to impose on the group of us today that these issues can be resolved relatively quickly by putting in a framework in place to which international philanthropy, as well as nations such as Australia, are able to plug in their expertise, and the financial community as well sees merit in providing their resources to help Somalia. So even though this is a tragedy, we believe there is a path forward, and commend the summit for opening a very active and important dialogue in this space. Thank you.
Thank you so much, Dr. Sotiropoulos. It was really a really interesting presentation, and with a very interesting highlight on the role of diaspora in philanthropy and how government can also support. It's really insightful. I will hand it over to Jawahir for the next speaker. Thank you again, Dr. Sotiropoulos. Thank you.
Thank you. Thank you very much, Raphael, and thank you again, Dr. Chris, for giving us your invaluable time in this late evening in Australia, and sharing us your expertise. Thank you.